Hello everyone, it's Dr. Nikki, the board certified family nurse practitioner back in the house. I hope you're all well and you're staying safe. In today's episode, I will be talking about a common mental health illness known as bipolar disorder. Bipolar disorder is a common mental health illness. It's also known as manic depressive illness. This is a brain disorder that causes like an unusual shift in a person's energy, mood, and ability to function. So when I say bi, I mean two. All right, when I say bi, I mean two, and I'll explain that. So bipolar can comprise of pretty much like two episodes. We have the manic episode, and then we have the depressive episode. In mania, so the episodes are mania and depression pretty much. So in mania, we have periods of irritability, we have periods of being overly high, we have being dramatic, and this could persist for days, 2 weeks, or longer. All right, and then we have the other end, which is periods of hopelessness, sadness, depression, which is a depressive episode. All right, so some people do experience normal mood in between the episodes. In between the mood episodes, you do have periods of normal mood between the mania and the depression. So we're gonna go into the two. All right, we're gonna start first with the manic episode, and then we'll go into the depressive episodes. For the manic episode, as I mentioned before, you have the elevated mood, which occurs with some other symptoms. So you can have the symptoms most of the day, nearly every day, for at least 1 week. You have the irritability, like irritable mood, and then you may have 4 other symptoms must be present before they can diagnose you with the manic episode or bipolar. So let's go into it. All right, so we have extreme irritability. I mentioned that before. We have excessive high mood, overly good mood, euphoric mood, and then we have poor judgment, spending sprees. You just feel so good one day and you just go out and you have $1,000 and you just spend all the money on something, and then you come back home and you be like, oh, what did I do? When you become sober. So anyway, so we have poor judgments, spending sprees, lasting period of behavior that is different from usual. We have increased sexual drive. Everything is high. Pretty much everything is high when you're in that phase. All right, when you're in the manic episode. All right, and then we have racing thoughts, talking very fast, jumping from one idea to the other. You cannot keep on a straight conversation. You're talking about something and you jump straight into another topic and you just start not making sense. All right, jumping from one idea to another. Racing thoughts, I said that before. You get easily distracted, you get very irritable, you do not concentrate very well, you're provocative, intrusive, you have aggressive behavior, you deny that anything is wrong when people are trying to say, something seems to be off, and you just say, no, everything is okay. All right, so that is the manic episode. You have to have, the elevated mood, and it occurs with the primary symptoms that I just listed, for most of the day, nearly every day, or for at least 1 week. And then you have to have the irritability, and then any 4 of the additional symptoms that I just mentioned must be present for a diagnosis to take place. So we're gonna go into depressive episode. So the depressive episode, remember I had mentioned that when you have depression, you are having periods of persistent sadness and hopelessness. Right, that's the other end of bipolar disorder. So for depressive episode, it's diagnosed if 5 or more primary depressive symptoms last most of the day, nearly every day, for a period of 2 weeks or longer. Yes, 2 weeks or longer for depressive episode. So we talk about the signs and the symptoms of a depressive episode. You could have restlessness or irritability as well. You can have difficulty concentrating, remembering, or making decisions. You sleep too much. For manic episode, your sleep is interrupted. All right, you have you just need little sleep pretty much because you're so high. You're in the manic episode, so you don't sleep that much. But in depressive episode, yeah, you sleep a lot. You sleep a lot. So you sleep too much or you have trouble sleeping. So it could go both ways. Some people that have depression, they sleep too much and they may have trouble sleeping as well. All right, then we have thoughts of death or suicide, all right, or that you've had suicide attempts, all right, and then we have changes in your appetite, unintended or unintentional weight loss or weight gain can happen when you have the depressive episode. And then we have feelings of guilt, helplessness, and worthlessness. Feelings of hopelessness, all right, you're in a sad or empty mood. You have sadness, you feel very empty, you feel like your life is not worth living, all right. Those are the symptoms of depressive episode, part of the bipolar. So it's pretty much like the opposite of manic, if if that makes sense. But there are some things that are kind of intertwined, with the symptoms. Like I said before, the irritability can actually be part of depression and part of the manic episode as well. All right, but it's very helpful that you get diagnosed, because a lot of people suffer from bipolar, but they're not officially or professionally diagnosed. People just guess that they may have bipolar. So it's pretty much like a spectrum of moods. You have one end of mania, and then you have the other end of depression. All right, so that's why we have two ends, and you could go from one end to another end, just like that. All right, so one end is severe depression, and then we have different types of depression. All right, we have mild, we have moderate, and then we have severe. All right, and then we have the other part of the bipolar end, which is the manic episode. All right, so next is the normal. Remember that I mentioned that you may have normal mood or balanced mood in between these mood episodes. Yes, so we have normal or balanced mood in between these episodes, and then you may go from like mild mania to feeling good, and then which is pretty much relatively brief or less severe, and then you can have severe mania, and then you start having, when you have severe mania, that's really bad, because you start having delusions, you start having hallucinations, you start having symptoms of psychosis. All right, when you have severe mania, it could include those. It could include the delusions, hallucinations, or symptoms of psychosis. Some people with that experience the symptoms of mania and depression together, we say that they have mixed bipolar state, if you do have them together. All right, so yes, when you do have both of them together, occurring together, you might have some agitation, trouble sleeping, changing your appetite, psychosis, and suicidal thinking. All right, and then if you have a very sad, hopeless mood, you may also feel extremely energized. And that's why I said some people experience the symptoms of mania and depression together. And that is a mixed bipolar state. So, what are you supposed to do? All right? What are you supposed to do when you have bipolar, or when you think your loved one has bipolar? All right, what are you supposed to do? Are you supposed to just leave them alone and just watch them from afar? You don't want to talk about it. You don't want to interfere. You don't want them to be, to feel like you're insulting them, that, they might have a mental problem. What do you do? What do you do when they have all these problems going on? So you have to be your brother's keeper. You have to be your brother's keeper. If it's your loved one that you feel like has this mental problem, because sometimes people have all these mental health problems and they don't talk about it until you finally see that it's getting out of hand, or probably they committed suicide, and then you'll be like, oh my God, this person had a mental health illness and I knew something was off and I did not say anything about it. All right, so you need to help the person. You need to bring it to the person's attention. You need to assist the person to probably go for accurate diagnosis, to get help, seek help. A psychologist, a psychiatrist, psychiatrists may be able to help. You talk to your primary care provider, get referred to a psychiatrist that would help you. Bipolar disorder can be treated. It's treated with mood stabilizers, it's treated with antipsychotics. There's safety of the person with bipolar disorder is very important. You want to make sure that they're safe, and you want to make sure that people that are around them are safe as well. So yes, they can be treated, as I said, with mood stabilizers, with antipsychotics, and also they need to be seen and accurately diagnosed and put on a treatment plan by a psychologist or psychiatrist. All right, they can also treat with antidepressants depending on what is going on. All right, so you can have a combination of a mood stabilizing drug. You can have a antipsychotic medications plus psychotherapy. You can have many medications are used to treat bipolar disorder, and I'll just mention a few. We have Depakote. Depakote is also known as valproic acid, and then we have lithium carbonate. Those are the medications that are very common in the treatment of bipolar disorder. And then, as I said before, the other end of bipolar is depression, so they may put you on some antidepressants as well. All right, and then Depakote is a mood stabilizer. It helps in treating the manic or the mixed phases of bipolar disorder. So when you have the manic episode, you need a mood stabilizer such as Depakote, which is valproic acid, and then you may need carbamazepine as well, which is Tegretol. Tegretol is another medication. Some people use it for seizures, epileptic. It's an epileptic drug. All right, so yes, you may need a combination of medication to work. You may need lithium to control your symptoms. You may need other medications. We have different medications out there that could be used, but the main thing is that you get diagnosed, officially diagnosed, and then they will put you on the accurate treatment. All right, a treatment that is suitable for you. All right, so there's no self-diagnosis here, there's no self-treatment here. You need to be seen by a specialist. As I said before, there are many medications out there, mood stabilizers, antipsychotic medications. We have different things, anti-epileptic drugs that you can use. We have antidepressants, depending on what's going on with you. So yeah, it's very, very important that you please help that family member. You please help that family member out. Help your friends, help your relative that you feel that is having mental health problem. Mental health problem is no joke. Mental health problem is no joke at all. It needs to be treated. You need to take care of it. All right, you need to be able to seek help, because it gets worse. It doesn't get better on its own. You need that diagnosis, you need the treatment, you need therapy, you need anything that you can do to help that person. All right, so how do you diagnose bipolar? All right, so there's actually no specific blood test that they do for bipolar. All right, so but as I said, it all involves your primary care doctor or specialist to perform a physical exam. Of course, they may do other lab tests to determine if you have some other issues going on, such as a thyroid function test or a urine analysis. They may do all those, but and then they may do some other tests too that may indicate or let them know if something else is causing your symptoms. All right, so but yeah, you do need to see a professional. You do need to see a professional for them to accurately diagnose you, right? And so yes, it requires one depressive and one manic or hypomanic episode. And then if you have any of the symptoms that I mentioned before, Yes, you may qualify for that diagnosis. So, to be diagnosed with bipolar disorder, a person must have experienced at least one episode of mania or hypomania. And then, mental health care professionals, they use a diagnostic and statistical manual of mental disorders tool, DSM tool, to diagnose the type of bipolar disorder that a person may be experiencing. Yes, so we have mental health care professionals. They have specific tools that they can use to diagnose the type of bipolar disorder a person may be experiencing. All right, so I hope this helps. I hope that you seek help if you do have bipolar disorder. All right, and I hope that you know that there's help out there for you. There's help out there for you. You do not need to be sad. You do not need to hide yourself. You do not need to be ashamed of having a mental health problem. You need to seek help. You need to seek help. All right, it can cause a lot of damage. It can cause dramatic mood swings. During the manic episodes, people can do and undo. You can feel high on top of the world, very uncomfortable, have this irritability, and you're all high up there. And then when you have the depressive episodes, you just go all the way down. You go all the way down. You have that moment of hopelessness, you have sadness, you have depression, you are suicidal, you're suicidal, you have suicidal ideations and all that. So it's not a fun thing to have. It's not a fun thing to have. You have extreme and intense emotional states that occur at distinct times, and that is not good at all. That is not good at all. So you have the manic episode, you have the hypomanic, and then you have the depressive episodes, and that is not good at all. So please seek help. Please seek help if you do have bipolar disorder, or if you know of anybody that does have it, or if you feel like your family member or your friends have a kind of mental health problem and you don't know what it is. Encourage them to go and get tested. Encourage them to go and see their providers to be able to get that accurate diagnosis, so that they can start their medication and they will be better. All right, so I hope this helps, and I will catch you in the next one. Share this episode with friends and family, and I'll see you in my next episode. Take care of yourself, continue to stay well, and stay safe. Bye bye.